What if I told you there's a technology that lets hospitals see into the future? Not with a crystal ball, but with data. This isn't science fiction, it's the power of digital twins, and it's completely revolutionizing how we think about healthcare. Imagine a hospital that never has to scramble because a critical piece of equipment suddenly fails. A hospital that knows exactly when a surge of patients is coming and is already prepared. This is the world that digital twins are building, right now. So, what exactly is a digital twin? Think of it as a living, breathing virtual replica of a physical system. It could be a single MRI machine, an entire emergency department, or even the whole hospital. This virtual copy isn't just a static 3D model. It's connected to the real world through a constant stream of data from sensors, patient records, and operational logs. Every change that happens in the real hospital is reflected in its digital counterpart, in real time. Now, here's where the magic really happens. We feed all this data into an AI. This AI uses the digital twin as its personal sandbox, a safe space to run simulations and test out countless what-if scenarios without any real-world consequences. What if we change the layout of the operating rooms? What if a major accident happens on the nearby highway? What if a new flu variant causes a sudden spike in admissions? Before, hospital managers had to make these critical decisions based on past experience and, let's be honest, a bit of guesswork. With a digital twin, they can see the likely outcomes of their choices before they even make them. The AI can analyze the data and predict potential bottlenecks, equipment failures, and even staffing shortages weeks or months in advance. Instead of reacting to a crisis, they can prevent it from ever happening. Let's talk about some real-world applications that are already making a huge difference. One of the biggest challenges in any hospital is managing bed availability. It's a complex dance of admissions, discharges, and transfers. A digital twin can monitor the flow of patients in real time and predict future demand. This allows hospitals to optimize bed allocation, ensuring that patients get the care they need without long, stressful waits. It helps reduce overcrowding in the emergency room and smooths out the entire patient journey. Another huge area is asset management. Hospitals are filled with millions of dollars worth of equipment, from simple infusion pumps to complex surgical robots. Keeping track of all this, knowing where everything is, and ensuring it's all properly maintained is a logistical nightmare. A digital twin can track the location and status of every piece of equipment. The AI can then predict when a machine is likely to need maintenance, long before it breaks down during a critical procedure. This proactive approach not only saves money but, more importantly, it saves lives. And what about emergencies? When a disaster strikes, every second counts. A digital twin allows hospital teams to simulate their response to various crisis scenarios: a fire, a power outage, a mass casualty event. They can test evacuation routes, coordinate staff deployment, and identify potential weaknesses in their emergency plans. When a real emergency occurs, they're not just following a static protocol, they're executing a plan that has been tested and refined in a dynamic, virtual environment. They are prepared, confident, and ready to act. Now let's expand this idea beyond the four walls of the hospital. Think about the entire healthcare supply chain. We all remember the shortages of critical supplies we faced in recent years. What if we could see those coming? By creating a digital twin of the supply chain, from the manufacturer to the warehouse to the patient's bedside, AI can predict disruptions before they happen. It can identify potential shortages of medicines, personal protective equipment, or even blood supplies. This allows the system to automatically reroute shipments, find alternative suppliers, and ensure that hospitals have what they need, when they need it. The result is a resilient, intelligent supply chain that is always one step ahead. The combination of digital twins and AI is shifting healthcare from a reactive model to a predictive one. We're moving away from a system that just responds to problems and toward one that anticipates and prevents them. This means fewer delays in treatment, a lower risk of medical errors, and a safer environment for both patients and staff. Ultimately, it leads to what matters most: better health outcomes for everyone. The hospital of the future isn't just a building where sick people go to get better. It's a smart, interconnected system that actively works to keep us all healthy. This is the predictive revolution, and it's already here. Thanks for joining us on this journey into the future of healthcare. If you're as excited as we are about how technology is shaping our world, make sure you subscribe to AI Neura Sky. Together, we'll learn with AI and master the future. See you in the next video.